Hi, welcome back. I see we have you back for a follow-up. Didn't we already have you in for a comprehensive full-body exam the other week? We did. Well, what's going on, my friend? What brings you back? Feeling any pain? Chest pain? Body aches? Trouble sleeping? Stress? Okay. A little body pain, alright. I can understand that. And how about stress? Lots of that. Well, the world is stressful, and stress can unfortunately have a lot of negative side effects on our body. So, why don't you just hop up on the table right there, and we'll get you checked out, alright? How about your health lately? I mean, outside of what you just told me, how's the alcohol consumption? Hopefully, keeping that down to a reasonable level. Alright. Well, why don't we start off easy and just take a listen to the old ticker there, huh? Just make sure that's sounding good. You know, as a guy, you have to make sure that you keep that heart healthy. Healthy diet, exercise, it's all important. So just stay still for me. Feel free to close your eyes if you'd like, and I'm just going to listen. Okay. And over here. Good. Mm-hmm. Okay. Down here. Alright. While I have these on, why don't you just go ahead and take a deep breath for me in your nose, out your mouth, in and out. Good. One more time. In and out. Good. And I'm just going to reach around your back here. Same thing. In and out. Good. And on the other side here, reach around and in and out. Good. Alright. And while I have these in, I'm just going to take a listen to your belly real quick, just to make sure those intestines sound alright. Alright. I know, a little awkward, but it'll be alright. So just stay still. Just breathe normal. Mm-hmm. Okay. Okay. Well, everything sounds relatively normal down there in the intestines. Heart sound good, lungs sound good, no smoking, right? Good. How's your diet been? And the bowel movements, everything working out okay? Hey, listen, this is the doctor's office. You can be completely honest with me. Anything going on stays between us. Listen, stress gets to the best of us. It affects all parts of our body. It affects our mind. It can affect our cortisol levels, which can make us gain weight. It can make us sleepless. It can ruin our sex lives. It can absolutely decimate sex drives in men and women. And nobody wants that. Come on. It's one of life's little pleasures. So we want to make sure that you are staying as healthy as possible. So why don't we go and take a look at the rest of you. We're going to do a quick physical exam. As I said, we listened to your heart, lungs, and stomach already. We're going to do a quick reflex test on you, just to rule out any kind of obvious muscular problems. So I'm going to just bend down here, get one knee, get the other knee. We're going to get the wrist, the elbow, and do a little jaw jerk. All right. So just stay still. Come down here, one knee, and 1, 2, 3. Good. And down here, other knee, 1, 2, 3. Good. Now, I'm going to take your wrist, and I'm going to tap it right there. I'm going to tap it right there, and then right there, okay? So just give me your wrist, and here we go. Very good. Other side. Good. And mid forearm. Good. And we're going to take the other wrist. Same thing. Good. Very good. Good. And a quick jaw jerk test. Thumb right under your chin. And 1, 2, 3. Boom. Done. Not a problem. Alright. Why don't we take a look at the rest of you? Look at me. Just going to do a visual inspection, make sure I don't see anything odd out of the ordinary. Draw it down for me a little bit. Just look at your scalp a little bit. Hold on a second. Let me just take a look here. Okay. All right. Well, scalp looks a little dry. Maybe recommend changing shampoos, adding in conditioner. Not seeing any major dandruff, but it's a little dry. I want to make sure we take care of that. I'm going to take a look in your ears real quick. As we get older, we don't want to lose our hearing if we can prevent it, so just stay still. And let me look inside. Good. Alright, that looks pretty good. A little bit of earwax. Don't be shoving Q-tips deep in your ear, no matter how good it feels. Okay, same thing over here. Not too bad. Not too bad. A little waxy. But overall, not bad. Alright, well, the inside of your ears look pretty good. But I do want to run a few just very quick hearing tests on you. So close your eyes for me and just let me know what ear you can hear the sound in, okay? Good. 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 Repeat the word after me. Coconut. Good. Chocolate. Good. Football. Good. Baseball. Basketball. Very good. Hockey. Wonderful. Well, I think your hearing is good. Just going to palpate your ears a little bit, just for thoroughness. You let me know if there is any pain. Any pain. Good. Alrighty. We take a look at that eyesight of yours. We want to make sure that obviously we're keeping our eyes healthy as we get older. So I want you to look straight at me, and I'm just going to run the light by. Good. Just keep looking. Good. 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 Now cover one eye for me like this and just follow the light. Good. Just follow that light. Good. Good. And we're going to cover the other eye now. And same thing. Just follow that light. Good. Follow the light. Good. Alright. Just going to do a quick cover test. Just cover one eye and swing the lid in. And now making sure those pupils are reacting the way they should be. Good. Good. And on the other eye. In, out, in, out, in, out, in, out, in, out, out, in, out, in, out. Beautiful. All right, so I'm going to get up real close to you here and look in your eye. You just look straight ahead for me. Good. And down. Up. To the left. To the right. Good. And the other eye. Same thing. And look straight. And look up. Good. Down. Good. Left. Good. Right. Good. Alrighty. That's all looking so good so far. Actually, just for thoroughness sake, let me take a quick look up your nose. You never know. Just lean your head back real quick. Just going to slip my otoscope up real quick. Good. Yeah, good. Great. Just take a look inside your mouth real quick. Everybody's favorite thing. Any history of smoking, chewing tobacco, cigar use, really any kind of smoking. Okay. Well, remember, smoking always increases the risk for mouth and throat cancer, and nobody wants that. So, use in moderation or don't use at all. Preferably not at all. Go ahead and say ah for me. And we are going to just look good. No patchiness, that's what I like to see. It's good. No red spots, no white spots. No obvious signs. To get your tongue for me, I'm just going to grab that and move it to the side. Good. Lift it up. And to the other side. Great. No problems. But you said it's been a lot of stress lately, huh? Your stomach's been feeling a little Alright. So what I'm going to have you do is I'm actually going to have you lay down on the table for me. And we're going to just do an abdominal inspection on you. Make sure everything is, working. Don't feel anything, masses, lumps, anything like that. Make sure that we're not finding any pain spots. Alright? Alright, so go ahead, hop up on the table for me and we'll get started. Alright. Are you comfortable? Alright, good. So I'm just going to work my way down your body, gently percussing, pressing on different parts of your abdomen. You let me know if you feel any pain at any time, okay? Alright, so here we go. So up here at the chest region, I'm just going to feel around your pectorals. Looking for any signs of fluid buildup, any signs of, swelling around the heart area. Also, though now, I know you may think it sounds silly, but this actually lets me check for breast cancer, as men can also get breast cancer. Alright. I'm going to weigh down your abdomen here, so I'm going to just press your abdomen. Any issues? Okay. How's the stress been impacting the love life? Not too good. That's understandable. Well, if you'd like, we can also examine that part of you today if you'd like, but if you are not comfortable, we can move on, and that's fine. Okay. Alright, so I'm going to feel down on the very, very lower part of your abdomen here, down by your bladder. You let me know if there's any discomfort. Just going to press in there. Anything. Okay. Let me feel this liver. You do have a history of drinking, correct? Okay. Just want to make sure it's not feeling fatty, swollen, or anything like that. Just going to reach down around here to your kidney. Feel that a little bit. Good. Same thing. I'm going to just... Alright. Alright. Well, I can't say I'm finding any problems. But what I do think you need to do is get a little less stress in your life. Alright. And any other part of you that's hurting today that you feel needs attention, one looked at? Okay. Your back. Alright, go ahead and flip over for me then. Your lower back, and it's very common, especially in men over 30. Mostly it's stemming from people having very sedentary lifestyles, sitting all the time, causing lots of compression on that lower spine, which just doesn't make anyone feel good at all. But there are many different stretches that you can do daily to actually help strengthen your back muscles and your spine, as well as doing core work to actually strengthen the muscles around the spine, giving a very, very firm support column for your back. But I'm going to take a look at your lower back here. I'm just going to how's it feel? Any pain there? Okay. Definitely seeing a little swelling here. How often do you have this pain? Daily? I might send, you know what, I'm going to actually write you a rec for a chiropractor visit, as well as some x-rays, because I want to see if there's anything going down, because I am noticing a lot of swelling to the left side. Have you ever experienced any pain that runs from your lower back, usually down one of your glutes, down into your leg? It's your sciatic nerve, and that can cause a lot of pain for people with back issues. So we'll look at that. Am I right? All right, well, you can sit back up and we'll go over the rest. Well, my friend, I have to say that physically, I can't find anything really wrong with you except for that little bit of swelling in your back. So as I said, I'm going to write you a rec for a chiropractor. Great guy. Take care of you. Crank that back, straighten you right out. Do want to get a couple scans just to make sure. And if you would like that other kind of checkup, I'm more than happy to provide that for you. All right? All right. Well, in the meantime, make sure you are eating healthy, getting plenty of sleep. Let's try to work on that work-life balance a little bit, okay? And you have a wonderful rest of your day. We'll see you soon. Bye-bye.